Hello, everyone. Thank you so much for joining me today. I'm going to be speaking to you about the Allied Health Workforce Diversity Act of 2021. But firstly, I'd like to tell you a little bit about myself and why I'm so passionate about this bill. My full name is Sean Yuenjamun Sami, and my pronouns are he, him, his, and I'm a clinical speech language pathologist practicing in medicine and a doctoral candidate of the MGH-IHP. And as you can see from this list below, I'm a first generation Indo-Caribbean, Latino, queer musician, clinician, and student. So I can tell you firsthand what it was like for me to be a person of color within the field of speech language pathology. And I could talk to you about the barriers that people of color and from diverse populations face within the rehabilitation services. So this bill, H.R. 3320, aims to help increase diversity within the field of speech-language pathology, audiology, physical therapy, occupational therapy, and respiratory therapy. And for the purpose of this talk, we're going to be honing in on my field, speech-language pathology. And we see that Black, Indigenous, and peoples of color within speech-language pathology make up only 8.6 of all members of the American Speech and Hearing Association. And when we compare these numbers to the US population, we're quite behind in the ASHA membership and affiliate population. So we could also look at this on this graph where we see the US population in red and the ASHA members and affiliates in blue. And there's a stark difference in white populations versus the BIPOC populations. So our workforce is not reflective of the US population. And you might be asking yourself, how did we get here? And the disparity started as early as kindergarten. And by the time students get to high school, there is a dropout rate that's much higher for Hispanic and African American students as opposed to white students. And this automatically reduces the pool of applicants to medicine and science. So there's also a cultural barrier within the health profession programs, and there's a perceived sense of loneliness and unacknowledgement within these clinical and academic settings from BIPOC members, and the absence of BIPOC mentors. So that support is not there for a lot of these students, and also the financial barriers that are innate within these communities. So student debt, the length of education, and navigating the financial aid website and forms is quite difficult for a lot of these students, as well as the population that these students come from mostly, which mostly comprise of low to middle social economic status. Once students are in the programs, there is a retention issue. So, you know, but while we need the academic and cognitive emotional support, we also need the financial support for getting through the programs because tuition is not the only thing that these students have to worry about. You know, when you're in a clinical program, you're also spending on books and supplies and clinical attire for clinical work, so scrubs and formal wear, as well as clinical seminars and certifications, which come towards the end of degrees, which could end up costing students, at least in speech language pathology, upwards of $1,000, which is quite substantial for students already paying tuition. And that is exactly where HR 3320 comes in. This bill will allow the Department of Health and Human Services to provide grants to accredited education programs within these given rehabilitative service fields. And these grants may be used to provide scholarships to support retention and recruitment from students of underrepresented groups. Specifically, Section 783 of this bill really highlights how this is going to help students through the programs, but also assist in the completion of prerequisite courses and retention. So, this bill was introduced to the House by Bobby L. Rush, who's a congressman and House representative, and it was introduced to the House of Representatives in May of 2021 by the Subcommittee of Health within the Committee of Energy and Commerce. And HR 3320 is actually modeled after an existing program, the Increasing Nursing Workforce Diversity Program. And interestingly enough, in November of 2021, the House Energy and Commerce Committee advanced HR 3320 by a bipartisan vote. So let's talk about why this is important. Why does this make a difference to our overall communities and the country? So overall, racial and ethnic communities are disproportionately living in areas of reduced provider access, and members of diverse communities are more inclined to work in areas with provider shortages. So, getting these students of color and from underrepresented communities are going to hopefully aid in reaching those areas of reduced provider access. And patients who obtain care from members of their own racial and ethnic backgrounds report overall better outcomes. And there's going to be an improved access to care, and this is going to provide greater patient choice of providers and overall patient satisfaction. And most importantly, targeting pre existing health disparities as well as those disparities exacerbated by COVID 19. So now it's your turn. I'm calling on you, and this will take you under 1 minute to do. If you pull out your phone and scan this QR code, click on the link, you'll be navigated to a page very similar to what's on the left of my screen right now. So you'll fill out your name, address, and contact information, but don't worry, the message body has already been filled out. And all you're going to do is click submit, and that's it. So, thank you so much for listening today. Please feel free to send any questions my way by messaging me at the email listed below. And here are my references. Have a great rest of the day.